So thanks everybody. It's great to see you all and to be with everybody, and so many friends and so many great researchers as well that I can see from the brief scanning. Next slide. Thanks, Valentina. Okay, so just an overview. Really what I'm going to do is to focus on the whole issue of COVID and look very briefly at the gender impacts. There's been a lot of research and a lot of publications on that. But what I also want to do is then really consider what are the implications of that from a value chain perspective using the global and reproduction analysis framework, which I've been using for some time. And then just think through what the gender outcomes are, and then really ask the question, are we going to build back better or worse? And so there's, I'm going to just try and talk for about 20-25 minutes and then leave plenty of time for discussion, because there are a lot of people who are participating in this webinar who have far more experience on the ground of these issues than I do, and they're complex issues. Next slide, please. So I should just say briefly, very importantly, that I'm drawing on research that I've done with the FCDO, the UK Government Foreign and Commonwealth and Development Office programme, Work Opportunities for Women, or WOW, as we call it, which is really focused on global value chains. I'm the research lead for WOW. And we've done 2 reports. They're both up there, and the web link is also in the chat box if you want the web link. One is called Hidden in Plain Sight, and the other is Building Back Equitably, which is really focused in more specifically on the impacts of COVID. The research that we did for COVID, I should say, was done between April and June, end of June 2020. It was desk-based plus a number, about 20 individual interviews with companies, civil society organisations, etc., all done virtually, clearly. Next slide, please. So firstly, just thinking briefly about the impact of COVID. I want to start sort of pre-COVID. What was a lot of the research that we were doing with WOW finding? A key part of that research was the engagement with a number of, with 3 companies, unnamed companies, where they gave us access to their supply chain to really try and analyse right the way through the supply chain the visibility of women workers, because we know that there is a real absence of good data and information, except for certain initiatives, for example, which do capture the data. And what we found going through, we looked at 3 types of value chain: apparel, agri-food, and personal care. And when we looked at all the data sources they had on women workers in their supply chain, we found a lot of weaknesses. A lot of data just isn't collected. Even though there's a large amount of auditing that goes on, some data gets collected, but a lot of data isn't collected at all on the number of women, and particularly when you move down to the lower tiers of the value chain. And then when you move on to the actual recording of data that's collected, it's often very poor. So even a lot of data that gets picked up, for example, in audits on women and men workers in the value chain, then doesn't get recorded properly, or if it does get recorded, the data gets overwritten, and once it's overwritten, it's lost forever, or remains in PDF files, which are very difficult to access, and that leads to very poor reporting. So we have very, very limited information on the real numbers of women workers in global value chains. So the estimates that we have that indicate there are hundreds of millions of workers, 400 possibly, and about roughly half of those, and nearly half of those, are women in global value chains, which now account for nearly around 2/3 of world trade. we really are gender blind in terms of how many, the real numbers of women, of workers in general, and particularly women. And this is especially so at the lower tiers of the value chain, for the sort of subcontracted work, labour contractors, migrant workers, casual workers. And a lot of the research that we've done in value chain analysis says that that is where women are concentrated. So there's a real problem of the invisibility of women workers in value chains. And this is before COVID actually hit. Next slide, please. Okay, so then COVID hits, and we're getting a lot of information coming out about COVID. We know there's been massive disruption into supply chains, and I'm going to go into that in a little bit more detail in a minute. But what the general headlines are telling us is that women are being disproportionately impacted by COVID. This is coming from United Nations studies, from sector studies, in garment sector, especially garment workers, and I'm going to talk a bit more about garment workers, were very badly hit. The impact of COVID is causing a lot of hardship, financial hardship, especially for low-income families, low-income workers who really have nothing to fall back on. And there are a number of studies showing that workers, and particularly women workers, who tend to take more responsibility in their families are really struggling in the face of COVID. A number of articles and papers, McKinsey's been particularly good on this, and I'll cite them again later, are arguing that we've got to have a better, more gender equality if we want to counter the regressive effects of COVID. Next slide, please. I think what COVID has really done, and people have said this in relation to a number of issues, but certainly in relation to value chains, is it's really exposed the weaknesses in value chains. And certainly when we were doing the really in-depth research in 2020, and looking at a large number of reports on COVID, not just those focused on gender, we were amazed how little gender was really being highlighted. Some organizations that have a very strong gender focus, NGOs, civil society organizations, the ILO in some of their reports, not in others, and the UN were highlighting gender, but a lot of the reporting was really ignoring gender. But we also know that if, given the lack of data and information anyway, the lack of visibility on women, a lot of companies in the value chain really didn't have the means to know, or the ability to find out what was happening on women within their supply chains. And yet we know that women were being disproportionately affected, and were actually playing a critical role in holding those supply chains up that were working and were operating, and often without proper support. And especially the problems, again, I'll repeat, at the lower tiers of the value chain, informal workers, and in small scale agriculture, where women are particularly concentrated. Next slide, please. So just to think of it now from a value chain perspective, and I think this is an interesting sort of dimension, is that what COVID has done is it clearly disrupted the value chain, but a lot of value chain analysis is really focused on the commercial dimension, the linkages between firms, and that's a critical part of understanding and analysing how value chains operate. But the interesting thing about COVID is that it generated a health crisis, which is a social crisis, a societal crisis. So it wasn't an economic crisis, very different from the 2008 financial crisis, which was an economic crisis which affected value chains. This was a societal crisis. And what it did is, and this diagram in a very simplified, is a simplified value chain, but in each segment of the value chain, there's a local labour market which feeds into that segment of the value chain. And underneath each segment of the each local labour market, there are the different households that generate the workers and interact with the value chain at a local level. And what the health crisis did, if you look over to the right of the diagram, is it really hit at three levels. Firstly, it affected people. It affected consumers. The reason why retailers were closed down was because in order to stop consumers mixing and spreading the virus. Secondly, it affected labour markets because it affected workers. Workers were unable to go to work because if they did, that would spread the virus. Or if they did go to work, it was only under very strict conditions. And that's had a big impact, I'll talk about, on the nature of work. And thirdly, it affected households. It affected households in terms of their well-being, etc. And in terms of the gender division of labour, women are increasingly part of the paid labour market, and particularly in value chains. Value chains have generated a lot of paid work for tens of millions of women workers who previously had no access, but they are constantly having to juggle that paid work with their engagement at household level. So I think next slide. So this is just to give a brief value chain perspective, and then I'll start to analyze it. But before we go on, very important, and I'm going to expand on this a bit more, is that the COVID did not have the same effect on all value chains. And there are different ways you can cut this, but the way I'm going to look at it is the difference between non-essential, what were classified as non-essential value chains, and essential value chains. And the obvious examples that I'll draw on are garments, which were very severely affected. A lot of garment production was closed down, and millions of workers orders were suspended. Many buyers cut and run, and there was big campaigns around that. And millions of workers lost their jobs. But then you go over on the other side and you look at agri-food. Food was essential. Everybody had to eat. So those value chains had to be kept going one way or another. But at the same time, they faced major challenges such as disruption in transport and logistics, big health and safety issues, and I'll go into some of those details in a second. Logistics and transport were caught somewhere in between. They have continued, but also have faced major challenges in keeping those value chains going. Next slide, please. So just to think through a bit more in terms of the analytical framework, what I'm really looking at is this link between the social and the economic, if you like, and I contrast production and gender profile of production, which is linked to paid work, which is predominantly men. Men are more concentrated in the better paid jobs, the more secure jobs, etc., versus social reproduction. These are activities in the home, in households that look after, help to reproduce current and future generations. That can involve household activities, food, etc., healthcare, caring for elderly, caring for children. And women are predominantly concentrated in that type of work. And that is an essential part of the gender division of labour, which is highly inequitable or generates significant inequalities within societies. What's interesting about value chains is the way in which the activities of social reproduction are increasingly commercialised, such as supermarkets producing prepared food, so you don't have to do it unpaid in the home, but have drawn in women to undertake many of those activities in very low paid work, undervaluing the types of skills they have. So if you, next slide, please. So just in the book that I published in 2019, I kind of demonstrate this very simply in this diagram where you have global production or productive sphere to the left, social reproduction to the right. The value chain is on the left is the commercial dimension, but on the right links into workers, their community or households, their communities, and at the very bottom, the work that the workers who then are drawn in from households and communities and help to produce the goods that are then produced and go into the retailers and then sold back into households. So this is a very quick, but we could go to the next slide, please. What COVID has done, oh no, sorry, back one. Yeah, what COVID has done has really to disrupt this linkage between global production and social reproduction at the points where people are directly engaged. So at the connection between retailers and households. So consumers are now having to stay at home and unable to go and shop, physically shop and also work between workers moving on into production. Workers are unable to go to work, with some exceptions, which but also very interesting. There's a sort of a line that's going from work to households, is the increasing home-based work, which is also now being done in order to avoid workers congregating. So you can see that there's a disruption taking place between the social reproduction and global production spheres. Next slide, please. So just to think through how this has kind of played out, this disruption has played out, it's played out very differently in non-essential versus essential. And again, I'm summarizing very briefly. The reports have a lot more detail in them, but I just wanted to highlight the three areas: the value chain disruption, the worker disruption, and then the gender and social household level and gender and social reproduction implications. So, I mean, for apparel, the obvious one is just non-essential, closed shops shut, brick and store closed shops shut, with the exception of online sales. So we always have to remember there's also a very rapid expansion. And again, I haven't got time to go into details. A lot of issues, many of the brands cut and run, the factories reduced or lost orders completely. There were major transport disruption and increased costs, and many of the suppliers bore the brunt. With some exceptions, buyers put the pressures onto suppliers. That led to a lot of job losses or furloughing. Casual and migrant workers got the most affected. There has been rehiring, so a lot of apparel is now growing up, expanding or being re-established. But there are anecdotal evidence that buyers are really cutting back on the total orders, concentrating their supply chain and reducing their total level of number of suppliers by about a third. That's anecdotal, but it's quite likely trend. So a lot of the workers who were pushed out the first were the casual workers, migrant workers. A lot of those is where women are concentrated. Working conditions were badly affected. Auditing where the production did take place went virtual, which raises issues about labour standards. And home-based workers especially really suffered. Traditional home-based workers. You also at the same time got this expansion of home working, particularly through online sales. So a lot of gender issues there, in that women were being forced back into the home, into isolation, increased workload, particularly childcare, facing much greater poverty and insecurity and food insecurity, and really lacks any, particularly low paid workers, lacked social protection and much higher risks of gender-based violence in those circumstances. Next slide, please. It was a different picture, though, in essential value chains and a much more mixed picture. And I am just taking two illustrations because there's actually a lot of in between, a lot of variations of what I'm highlighting in between. But with horticulture as an example, fresh vegetables and fruit, those were essential. So those retailers are allowed to stay open. Those producers producing those goods in most countries were allowed to continue producing. They had to continue hiring labour. They had to prioritise health and safety of those workers in order to maintain production. But at the same time, they did face significant challenges. One of the big challenges for global horticultural production especially was disruption to transport and the increased costs of transport. I mean, just as an example, a lot of African, where I work, a lot of fruit and veg, not all, but quite a proportion of it is air freighted underneath passenger, in passenger planes underneath the passengers. Of course, the passenger planes stopped, the air freight stopped or became much more difficult to organise. So that's just an example. So that had different effects on workers. So in the stores that stayed open, the majority of store workers, consumer-facing workers, are women, and lower paid. The majority of women, particularly in packing, in production of food, are women. So these were highly exposed workers. Managers could stay in their offices or work from home, not those who are directly facing customers or producing the goods. Social distancing was very, very important, but social distancing, particularly at producer level, also led to a reduction of hours. If you socially distance, you couldn't have so many workers in at the same time. So for many workers, even though they continued working, they weren't retrenched, they still had less hours, less pay, less overtime. And for those that were in work, had to work a lot harder. And again, it was the casual and migrant workers that were more likely to be pushed out rather than the permanent workers, who are more likely to be male. And they all faced high social, health and safety risks. And again, the gender implications of this is the constant juggling of paid and unpaid work, trying to look after children, potential cases of illness in your household at the same time as working. So despite continuing more opportunities to continue working, you still had falling incomes and food insecurity. And other risks that you got in the essential value chain as well. Next slide, please. So just to sort of think through what the implications of all of this are, so I've just sort of highlighted some of the kind of key areas. The real question, and that's the real question for today, for me, and hopefully the discussion in this webinar, is are we going to, there's a lot of talk about building back better. And what does building back better actually mean? Does it mean business as usual? Does it mean worse conditions for workers, and particularly for women workers? Or could it be more equitable? Now, there are different views on this. The UN did a big report, and they've argued that, in which it was argued that the COVID crisis could set back women's empowerment by 30 years. A whole generation of women were going to lose out. But a number of other reports are arguing that it is possible to have a more equitable recovery. And at the other extreme, you've got McKinsey, who have certainly been doing some excellent background research on this. They've done an estimation that if you build back more equitably, you're going to, or a recovery that is more equitable, will generate 13 trillion more for GDP by 2030 than a recovery that is not managed in an equitable way. And from a GVC perspective, from a value chain perspective, there are a number of issues I think we need to think about. First is really purchasing practices, that cutting and running, that has really got to be addressed, because it's the lowest paid, most insecure workers that get most affected. And that's got to be addressed systemically, because without that, you get the falling real wages and the harder work. And one of the big concerns is that with the rehiring of workers and the re-establishment of production, that the same kind of norms that were put in place, certainly in horticulture, but also in apparel as it got production came back in, is that it'll be with lower real wages, and the workers in production will be expected to work harder for a lower real wage. And again, it's largely the more insecure workers, women are concentrated, who will be most adversely affected by all of this. We need to think through what the implication of online sales expansion will be for workers as well. I haven't gone into the distribution side which is a big issue here. I haven't had time for that. But it's really important that with the expansion of online sales and linked to that also automation, because of course some of the factories that did survive or found it easier to survive were those that were more automated. So will that be an incentive to automate more? And again, will that lead to the displacement of women workers with lower levels of skills? Digitalization is another big issue which has really come through. A lot of communication with workers is now digital, but women workers much less likely to have mobile phones or internet connected than men. So there are a number of issues that really have to be addressed. Next slide, please. So just in terms of some general kind of points in terms of how, or my thinking about how we could build back more equitably. I think the first thing is we've got to know who the women workers are and where they are in order to be able to support them and be able to track what impacts are. And at that moment, we don't have that information. But absolutely critical as production does hopefully get re-established and the value chains get regenerated, there needs to be much more clearly and transparent equal opportunities in rehiring and hiring, in pay, in training, particularly with automation and online sales growing. If women workers aren't getting the same training and skills development as men, you're clearly going to get gender inequality. And in promotion, we've got to break this glass ceiling which has been blocking women moving to the higher tiers of value chains. And the second area I think is really critical is in that process, women workers have to have a voice and being consulted, equally participate, or be able to actively participate both through trade unions, through other civil society organisations, in order to ensure that there are gender equitable strategies that really take into account the kind of challenges women workers face. I haven't had time to go into social protection. That's been a major issue, or lack of it, particularly in low income countries where a lot of sourcing is concentrated and where millions and millions of women work in global value chains. But there need to be much more effective social protection strategies, but also I think with that, alliances between public, private and civil society organisations to ensure that more marginalised workers, the more vulnerable workers, again, more often women, get access to that. The next one I think is really important, and I think this is where the crisis has really shifted the relationship between the commercial and the social, but because without it, it's the societal disruption that caused or the health crisis that caused the societal disruption that caused the value chain disruption. So there needs to be recognition that the social is actually a critical part of the full or sustainable operation of value chains, and that then in that there has to be support more for women workers, recognition of the roles that they play is both paid and unpaid, and how critical those roles have been in getting through the pandemic. And finally, there's a lot of talk about gender equitable social contracts. That's one of the ways that Danny Roderick at Harvard University was one to advocate this, many others have. But I would love to see in those reports on a social contract, more on gender equality being a key component to it. A little bit too light on the gender, too strong on building alliances without mentioning the differences between men and women, and that gender equality has to be a key component of it. And then finally, final slide, please. So this is just a sort of very brief overview. As I say, there's more information in the two reports that I've put. The web link is in the chat as well if you need it. And the book as well has more. My book has more on the kind of more analytical background to this, but I've tried to bring those dimensions together and just to have some key questions for everybody. Now, what are the gender challenges emerging from COVID, and how can we really build back a much more equitable value chains in the future? both in terms of what companies can do, what policymakers can do, but we're an academic community in SASE. What can we do to ensure that there's better gender data, information, and recommendations coming forward to help to strategically build back more equitable value chains?